Now we will see T-scan in orthodontics. So various application of T-scan in orthodontic treatment. T-scan can be used in all the stages of orthodontic treatment, like during initial assessment, the to assess the temporomandibular disorder, T-scan can be used. So the prevalence of clinical signs of temporomandibular disorder in non-patient population have been reported in few epidemiological studies as being higher than the prevalence of symptoms reported by actual TMD patients. Halkimo study shows that the equal prevalence of TMD in orthodontic treated and non-treated subjects. So the T-scan studies involving patients with TMD have both increased occlusal time and prolonged disocclusal time and the presence of TMD symptoms. So this can be assessed during the initial assessment before the orthodontic treatment by using T-scan. Now during follow-up treatments, this is important usually in class 2 elastic cues where the roval molars tend to extrude with their distal cusp leading with the occlusal time more than zero point 0.2 second. Additional wire adjustment should be made on the molar teeth. So lateral successive movement to ensure that the upper and the lower canine occupy the correct position in the extraction uh, and non-extraction cases. So it should disocclude posterior on lateral movements. Now the during distalization. So sagittally directed tooth movements in the posterior segment of the uh, arch. So sagittally tooth movement generally cause parental changes of the main supporting cusp, which lead to changes in the vertical dimension of occlusion that lead to acute pain and parental abscess formation in its opposing lower molar. It will lead to acute painful contacts. So the patient is asked to first clench his or her teeth together into the T-scan sensor and then to grind repeatedly to both sides back and forth. After that disocclusion time should be maintained 0.4 second after occlusal adjustment. So prior to debonding, improper tooth alignment combined with deflective interferences have been shown to be contributory to orthodontic relapse. So orthodontic goal is to decrease the amount of non-axial occlusal forces and to redistribute the occlusal load between as many as teeth as possible. So this can be done by using T-scan. Now during retention phase. So retention phase has two major aspects of concern, the longevity of anterior alignment and the changes in the number of contacts in the posterior segment. So the occlusal interference will lead to decreased disocclusal time, so it should be adjusted. So this can all be used during T-scan and occlusal discrepancies during the orthodontic treatment can be successfully treated. Now we'll see an article titled as T-scan occlusal analysis after adult orthodontic treatment by Svetlan Koval et al. Published in the Journal of Clinical Orthodontics 2016. So the adult patient present particularly challenges to the orthodontist, including such problems as compromised occlusion, cervical abfractions, and enamel wear. So, occlusal factors can contribute to the development of parental disease, abfractions, which is a pathological loss of tooth substance caused by biomechanical loading forces. So here is a 29-year-old female patient presented with a chief complaint of upper and lower front crowding in the upper and lower front teeth. She had a class 1 molar and canine relation on both the sides, and all third molars were fully erupted, as you can see in the OPG. So after evaluation of functional occlusion with an articulator, non-working contacts were observed on the third molar, because of the uh, because of the third molar over eruption, the occlusal plane was tilted. The attrition was occurring on the occlusal surface of most teeth, and abfractions facets were seen on the upper right canine, premolar, second premolar, and first molar, and upper left canine, first premolar, second premolar, and lower left canine, premolar and second premolar, and lower right, first and second premolar. Cephalometric analysis indicated a skeletal class 1 malocclusion with a horizontal growth type and slightly proclined lower incisors. So the treatment plan consists of third molar extraction, leveling, aligning, occlusal plane management, and arch consolidation. As patient insisted on aesthetic orthodontic appliance, so uh, she has given a lingual orthodontics, and here is the post orthodontic uh, post debonding pictures where you can see the upper and lower crowding was resolved, and class 1 canine and molar relation was maintained. So as the patient is having occlusal wears and abfractions, so the T scan was done on this patient. So here is the T scan results images. In figure 1, you can see initial contact at upper right first molar with 100% of force at 0.05 second localized on one tooth. And in figure 2, you can see a closing stage exceeding zero point 0.6 second in duration with contact remaining solely on upper right first molar from 0 to 0.085 second, and in uh, figure 3 you can see a contact of upper first molar remaining up to 3 seconds of the biting cycle, and in figure 4 you can see unequal arch balance at the end of the closing stage with the upper right first molar contributing for nearly 30% of overall force. Now, in this figure, we can see overloaded occlusal contacts on molar right first molar in static occlusion with contact on slope of mesiolingual cusp remaining through entire bite sequence. And in this figure, we can see overloaded contacts appearing red, red or orange at 86% of force. And in this figure, we can see duration of closing stage reduced after adjusting contacts between upper and lower first molar and left second molar. So in this figure you can see no overloaded uh, contacts at 86% of force after occlusal adjustment. Now, in the functional occlusal analysis during the left lateral traceo movement, the trajectories of force, here you can see in the red color, trajectories of force was non-linear, indicating both working and non-working posterior contacts, and the contacts of the upper left first molar persisted until late disocclusion. So in this figure, you can see after occlusal adjustment, the trajectories of force become more linear and the working posterior contacts have disappeared. So coming to the conclusion, the main purpose for performing a T-scan occlusal analysis after orthodontic treatment is to control the balance of the occlusion, including the balance between the right and left side, and the sequence of contacts as closing, and to identify and remove any overloaded contacts. In an adult patient, this will improve the stability of the results and avoid any recurrence of dental abfractions or abrasions. Thank you.